Hi everyone, and welcome to the Quillen ETSU Physicians webinar for Allscripts Basic Navigation for the clinical staff. Once you've logged into Allscripts, you will automatically be taken to your workplace. The workplaces in Allscripts are defined by your user role, so the word clinical staff should appear here in the upper left-hand corner. If your workplace does not say clinical staff, please let us know, as we will need to fix this for you. Now, I'd like to point out some of the features and terms in the workplace, as you'll hear these often throughout training. The tabs across the top of the page, provider schedules, daily, clinical desktop, note, etc., comprise your horizontal toolbar, or the HTB. The links on the left-hand side of the page are your vertical toolbar, or the VTB. When we want you to navigate to a specific area during training, we will use the terms HTB and VTB so that you can find items quickly. Now we're going to pull in a patient here so that we can demonstrate the patient banner. There are several ways to pull up a patient, and the recommended and most likely method is to pull them in from the doctor's schedule, but we want to show you how to pull a patient into the banner without accessing a schedule. Underneath the HTB, in the left-hand corner, you'll see a link called Select Patient with a drop-down arrow next to it. Click on the arrow, and a small box appears which will have two choices, Search and Clear. Clicking on Search will bring up another box in which you can type the patient's last name. Notice too a small field next to the patient field, and if you click on the drop-down arrow, you'll see that you can search by things other than name. You can search by date of birth, medical record number, social security, whatever. And this can be set to default into date of birth or one of any of these options if that's how you generally search. We'll go over that later. Now, in the patient field, you're just going to go ahead and type the patient's last name or even part of it, and then click Search. And then choose the patient that you want, and it should highlight it in yellow, orange color, and then click OK. And notice here the patient's name and their demographic information has pulled into the patient banner, which is this area underneath the HTB. You'll hear us refer to the patient banner often. Now we want to go over some of the information in here. As you can see, the patient's age, sex, and even allergies, date of birth, primary care physician, etc. all populates in right here. Now we want to look at a couple of the icons that you can find here on the banner. This FYI icon in yellow basically has just useful information in it that can be used by the front desk or the clinical staff. Information populated here is usually something like patient is hard of hearing, or the patient's a drug seeker, or something like that. If the box is yellow, that means that there is information in there. If it's grayed out, there's nothing in there. So that's a quick way to, you can just open that and see what that information is. Now over here there's a small blue I, which actually stands for information icon. And if you click on this, this is basically where you can change the demographic information. Notice here the FYI box is also here, so you can view this here. And the chart alerts box, which is basically for clinical information that you want to appear on the patient's chart. And we're going to show you how to add an alert here. If you click Add Alert, there are some options that you can just choose. We're going to choose Known Drug Seeker and hit OK. And as you can see, it pops up here in red, and we'll show you where that appears later. We also quickly want to show you where this yellow icon that shows up on the patient banner comes from. This is the medication history consent, and as you see here, it's currently set to unknown, which means that nobody has asked the patient for this consent yet, and that's when the yellow triangle icon shows up on the banner. Now if you change this to granted or declined, if the patient has said yes or no on the medication history consent, then it disappears from the banner. It's only there if nobody has bothered to ask yet. So that's a quick reminder that you need to receive that consent. Let's scroll down through here real quickly, and this is just where the demographic information sits. Most of this information does flow over from Experior. As you can see, there's no way to add some of the information here. But down here at the bottom, you can add a pharmacy, you can add an RX benefit plan, etc. And this is just basically, this is where the demographic information is. Now when you first log into Allscripts, you should default to the daily schedule page. To pull in a physician's schedule, we're going to click on the blue All icon next to the provider field, and in the search for box, type in the provider's name. We're going to use one of our fake physicians, and you can either hit enter or click on the green go button. Now highlight the one you want and then hit OK, and it pulls in that physician's schedule. Now there's a couple things we want to point out about the daily schedule page. You can pull in more than one provider here. We'll show you again how to do that in a different session. And you can change the date of the schedule by clicking on the calendar icon next to the date field and just choosing another date and then clicking OK. You can also change the date if you just want to navigate within the same week by clicking on these buttons here. We have basically all the same information for the entire week here, which is why it doesn't appear to be changing. If you want to move forward or back a week, these little black triangles here on the right hand side of the screen will navigate the schedule forward a full week or backward a full week. And if you get too far afield and you want to just go back to today, you can click on this button. Now a couple of other things we want to point out. Under the A column, this stands for arrived. So if the patient has arrived and has been checked in by the front desk, the letters ARR in green will appear here. If they have not yet arrived, then this will stand for pending, the PEN. Now, the patient status and the patient location here is information that you will be adding once you put the patient back into the room. And this is a really handy way for the physician to just glance at his schedule and see what room his patient is in and if they're ready for him or her. And the way you do this is on this floating clinical toolbar down here. You can just change the room number, and these are specific to your particular office, by the way. So if you're in peds, you can, that should have the peds office numbers. And let's click on one of these that's been arrived. And as you can see now, the status you can change the status here. You can't change the status on a patient if they haven't arrived yet. So that's what the patient location, the patient status is. And one other thing we want to point out quickly before we get off of the daily schedule is the tasks area. This is basically a to-do list for the patient. So you can see here that Diana has 5 tasks assigned to her. Now to view those tasks, you're going to go to the HTB and click on the tab Task List. And as you can see here, the view has defaulted to My Active Tasks, and those will be tasks that are assigned to you or to a team that you may be a part of. Okay. Now if you want to view all of the tasks that are due on the patient who's currently pulled into the banner, you're going to click on Current Patient Active, and as you can see, these are all of tasks that need to be done on this particular patient. And they vary for everything from finishing a patient note, which is probably something the doctor will be required to do, calling the patient back for phone calls, giving immunizations, things like that. So that's your task list. Now let's go back to the daily schedule, and we want to show you one more thing about the patient banner. If you notice, if you single click on any patient name from the schedule, their name populates into the patient banner. Okay, so we do encourage you to start getting in the habit of checking the banner anytime you're doing anything on a patient to make sure you have the correct patient in there, because it's really easy to get off of the patient that you're working on. Now if you double click from the daily schedule on a patient, it basically opens their chart. And as you notice on the HTB, we are now in the clinical desktop, and that is basically the patient's chart. Now we want to point out a few things on the clinical desktop here. First of all, that floating toolbar that was sort of appeared at the bottom of the screen on the daily schedule page has now been docked, and it's right here. And as you can see, the patient location and patient status is on this bar, and the floating clinical toolbar, that's basically where you'll start documenting a note. But again, we'll go into that in a different session. We just want to show you the screen here for the clinical desktop. And as you see on the left, you have a large pane with 5 tabs. You have Problem, Notes, Labs, Imaging, and Chart. The Problems tab is where the basic, the patient's active problems are. And if you click on the drop-down arrow in the view, you can look at their past medical history, social history, family history, or everything, depending on what you want to see. The Notes tab pulls in all of the patient's notes. And again, you have a variety of different views. You can look at everything. You can look at the notes by specialty. And this will come in really handy if you're in internal medicine and say you need to look up and see when the patient was last seen in OB and what they did. You can actually view OB's notes. So that will be really handy. The next tab is labs. This patient doesn't have any labs or imaging, so that's why these are empty. And then the last tab is the chart. And again, you have a variety of different views, ways in which you can look at the chart. And this is the full chart. So if she did have labs or imaging in here, this would all appear here. Now the component over here on the right-hand side of the screen has the patient work list. There currently is nothing in there at the moment, but there normally will be information in here. Medications, their allergies, any orders on the patient, and this last section here for appointment, which shows you all of the appointments that the patient has upcoming in the entire organization. So that'll come in really handy. And the bottom component is basically a series of graphs. The first one is vital signs, second one is immunizations, flow sheets, which are things that we can build for a variety of things. Right now we have anticoagulation flow sheet in there, a growth chart, vitals, and we can build these for you or for your physicians. And then HMP, which is the health management profile. And we think these will come in really handy because it's just a quick way of looking back and seeing, vital information on the patient. And that's basically it for the clinical desktop. In the interest of time, we're going to go ahead and stop here today. And if you have any questions or anything that you would like to let us know about, if you have any flow sheets you think your doctor will need, please feel free to give us a call. And we really appreciate your time. Thanks so much, everyone.